everyone, and welcome to a special webinar that we are putting on here with Fullscript. Today we're going to be talking about harnessing the power of group visits. Now, you may think that this might be weird timing, given that not many people have been meeting in groups for a long time, but incredibly, we saw that the CDC has said that people who are vaccinated can meet inside, which was unexpected, but that came out on Monday, and we planned this way ahead, so there must have been some prescience there. And also, one of the things we're going to talk about today is a little bit about virtual group visits and the potential of doing these kind of things virtually. So a warm welcome here. My name is James Maskell. I'm going to be leading this webinar today. And just to give you an idea of what we're going to cover today, we're kind of going to cover harnessing the power of group visits, why and how you should implement them. Now, because I wrote this book, the Community Cure, last year, I did a lot of presentations about group visits. And so just be sure that today is not going to be like that. We are going to do something very different here today. So I'm super excited that those of you who have made it live are live. If you have questions, you can put them into the question box. If you have chat, you can put them into the chat box. We've got the team here that'll be able to make sure that they can see all of those details and make sure we get your questions answered. So this is what today is going to look like. So first, I'm going to give you an epic free gift for showing up and being here today. Thank you for making time to be part of the future of healthcare. And we're going to talk about why group visits. The second thing is I'm going to share 4 ways to implement groups in your practice, like right away, that don't require a lot of implementation, that really makes sense in dealing with some of the sort of cumbersome elements of running a functional or integrated medicine practice. I'm also going to share 4 things that I've learned in the last year since the book came out about implementing, and we're going to talk about virtual on that end too. And then at the end, make sure to stay until the top of the hour, because we're going to have 2 massive announcements at the end of this presentation, one from me and one from Harry from Fullscript, who'll be coming on to just talk about how Fullscript is in alignment, that they believe that that group visits will be a significant part of how functional medicine reaches the masses. And so we got an exciting announcement from them about some of the functionality inside of Fullscript to make it easy for you to prescribe a whole range of supplements and also other services to groups of people at a time. So first, I promised you an epic gift, right? So my book, The Community Cure, is on Audible and you have to pay for it, but I maintained the rights to it just so I could give it away for free to all of you here today. And throughout, because ultimately we want as few barriers to entry to people to learn about this. There is no way that I can do justice to the title of this webinar in an hour or in 55 minutes, because Harry's going to speak at the end, because there's a lot to say. And this book, I really created it so that any practitioner could read it or listen to it and not just like get inspired to want to do groups, but the whole of chapter 6 in this book is all about the step-by-step guide to implementing groups in your practice, right? So I made it so easy, as easy as possible, I guess, I hope, to you to read that and go about thinking about a 90-day plan to launch a group visits, and it's all in there. So if you go to thecommunitycure.com/audiobook, you can download that now. It comes in one long MP3 file, but you can listen to it in your car, on your commute, in your earbuds, however you listen to content. Check it out. And I wanted to give that away for free because I don't really want to go through all the details today. I really want to get practical for everyone. And so that's my gift to you. So thecommunitycure.com/audiobook, you can go there and you can download it now. So that's the first thing. Now, just a couple of pieces. So the first thing is, this was one of my favorite diagrams in the book, and these are a couple diagrams in the book. And a word that I introduced some people to, I think a lot of people understood it before, is this understanding that in general, chronic disease is biopsychosocial in nature, right? There are biological, social, environmental, and psychological reasons why people get chronic illness. And ultimately, functional medicine is a great standard of care above conventional medicine because it recognizes some environmental inputs, right? So like toxicity. But there are many other social environmental issues that play a role in chronic disease, and certainly psychological issues that play a role in chronic disease. And if we don't deal with all three of these, we never have a chance to get to the kind of elegance of solution that you all know is possible with the medicine that we're practicing. Just take a moment to think about a patient that you've worked with where the solution was complete, where the person was now able to live their life eating healthy, living healthy, and didn't need you anymore because they had achieved self-efficacy, right? They knew how to be healthy. That is the goal for all of us in practice, is to empower people towards being healthy. And if they have social environmental issues and psychological issues that are driving their illness, we have to deal with those things. Otherwise, we never get that full solution. And if you haven't provided those solutions, then this person either doesn't have those components or is getting it elsewhere. And what I want to show in this webinar is that groups, when mapped onto the psychosocial model, achieve health for the individual, self-efficacy, self-regulation of emotions, mindfulness, engagement in life, self-monitoring, self-directed behavior, skill or technique acquisition, right? And constructive attitude and approach, like that happens to the individual. Also inside the group, you'll see changes in their interpersonal well-being, and then you see implementation and so forth in the organization, a bit larger, and then also in the larger community. And this is why I'm so excited about the group visit model and this sort of cross-pollination of group care and functional medicine, because I believe that the group model, when sort of added with the functional medicine operating system, we now have an empowering system for everyone to participate in. We now have almost like a curriculum of education that can be provided through functional medicine. We now have a common language for practitioner teams to communicate in, and we have a model for what could be, a future of medicine built around chronic disease. So that's why I just wanted to start with that as a starting point. These are two diagrams from my book just to get into it, because ultimately, what I came to see from functional medicine and integrated medicine in the way that it's originally been practiced is that in general, it's been unaffordable, inaccessible, super inefficient, right? One doctor for 2 hours with the patient. There could be any less efficient model of care. Patients are still isolated because they're not being dealt with, apart from they're still having one-on-one appointments, and behavior change is hard to execute. How many times have I heard that the patient went to the functional and integrative doctor, got an epic, protocol, but then it's like a full-time job to execute that protocol. And that's, the thing we have to recognize is that if functional medicine can't be for poor people, it's not particularly functional, right? We have to build systems to get everyone healthy. And there's even, I saw an article today saying essentially that, your life expectancy in America today is really determined by your level of education. Like Black people with a bachelor's degree live about the same length as white people with a bachelor's degree. But as soon as you start going down, the numbers don't look so good. And that's why there's a real educational gap that we have to fill. Now, when we do functional medicine in groups, where once it was unaffordable, now it's affordable and can be done, on insurance and Medicare. Where once it was inaccessible, it can be everywhere. And especially we're going to talk about virtual groups moving forward, because it can be delivered in all kinds of offices. When it's inefficient, now it's super efficient. It's literally the opposite of the old inefficiency, right? If one doctor has to spend 2 hours with a patient, now you've got 0 doctors, like you've got in the Cleveland Clinic, for instance, PAs, health coaches, and dietitians working with 15 people at the same time. It's the other end of the spectrum when it comes to efficiency. Now people are deeply connected and are working together to make behavior changes, and now behavior change is fully supported. And I guess I just want to be in reality with all of you, and maybe you can tell me if I'm wrong in the questions. But from what I've gathered from being in this industry 15 years, is that if you look at the patients that are doing the best 5 years out, like from the moment you do your first appointment, the patients that are doing the best in 5 years are the ones that do the lifestyle and behavior changes. And so ultimately, part of what we have to do is to really double, triple down on working what's going to be a good fit. I have no doubt that a one-on-one long appointment is great for precision medicine. But ultimately, functional medicine is not just precision medicine. It's precision medicine plus lifestyle. Like if you look at the functional medicine matrix, it's lifestyle at the bottom. It's really understanding how we first facilitate lifestyle, and then if and only if people don't get better from that, we can go in more precision interventions. And that's what they're seeing now at the Cleveland Clinic, where people have to go through a 10-hour 10-week, 2-hour-a-week group program before they ever get to see Dr. Hyman. And now it's available and being delivered in a super efficient way on insurance, right? So I want to share with you 4 examples of where I see groups happening in practice right now. If you feel like I've missed some parts of this, it's all in the book. So go to the communitycure.com/audiobook. It's free. You can download the audio and you can listen to the whole thing. I go through all of the different pieces. Dr. Geller, we talk about centering pregnancy. We talk about, the Cleveland Clinic group visit model. We talk about Dr. Shilpa Saxena. We've got Ornish. We've got Jim Gordon. We've got all the different ways that it's doing. But this is some of what I've learned in the last couple of years about where groups can easily be applied in practice today. And I want to talk about what are the things that take up an inordinate amount of time in functional medicine offices that make it super inefficient, that when done in a group has like a real elegance to it. So I'm sure many of you are familiar with, practice orientation. And I interviewed Kerry Sutton on the podcast last week. Here's a nurse practitioner. She decides, okay, there's so much information that needs to be communicated to patients. And if I communicate all of this information ahead of time, the appointments go much better. Why don't we just have the entry point to the practice be an orientation? Starts off with her doing it, and it's basically her talking for an hour. Then eventually the office manager's doing it, and now the office manager's talking for an hour. But now the innovation that comes, or the evolution of it, is that the orientation that's still once or twice a week is half an hour of information delivery and half an hour of real engagement in a group. Because what it's preparing patients for is the fact that being in a group is cool and fun and useful. Because let's be honest, other examples of groups is not cool and fun and sexy and aspirational, right? Alcoholics Anonymous is none of those things. What it is effective at getting people away from alcoholism and reversing alcoholism, but it's not cool to be in an AA group. And so ultimately, what we found time and time again is that most people don't think they want to be in a group until they find themselves in a group, and then they're like, I love being in a group, because they realize that there's other people that are just like them. And certainly when you're dealing with a chronically ill population, right, who doesn't have another family member who can't eat gluten, who doesn't have another family member that's trying to get off a psych med, has never met anyone else, putting them in touch with other people like them is about the greatest gift that you could give them. So Kerry Sutton does it in the orientation, right? So, and just as a hybrid note from this, when COVID hit, they canceled the orientation and they just put people straight into the schedule. And they only realized at that moment just how valuable the orientation was, because ultimately they were dealing with so many questions in these appointments that had used to be dealt with in the orientation, and now they do a virtual orientation, right? So that's one example, orientation. The second is intaking, right? Doing the whole intake, sitting with the patient and going through the whole timeline and matrix. Everyone is proud of how detailed and thorough their history and intake is. However, it's super inefficient. And Dr. Lara Salia, who has a completely cash practice, created an intaking group visit as a way for people in the community who couldn't afford the $300 initial fee for her first appointment in rural Wisconsin to do an intake group where they charged $30, and then people would come in, do their intakes all together, learn from each other, and leave with an IFM toolkit, an IFM prescribed diet that she would customize in that session. And a decent percentage of those people then upgraded to the one-on-one appointments because now they saw the value of functional medicine, right? How many patients have you ever found that when they line up their timeline and they're like, oh, I see now how I ended up with Crohn's or colitis because I ignored all of these other symptoms that were going on forever, right? So imagine having that aha moment in a group where everyone else is now validating that aha moment. It makes a big impact on how people, how people then behave in the rest of their practice because they know they're not weird, right? And they've been feeling weird for a long time because their conventional medicine doctor has no answers for them. So an intaking group visit is really powerful. And in my book that I just gave you for free, in one of the chapters, we literally go down Lara Salya's group visit and exactly how she did it in that one. Okay, another one which came up last year is lab review, right? Lab review is cumbersome. Dr. Christopher Moat realized that 90% of the information that was happening in his lab review appointments was the same for every patient, and only 10% was individual. So now he's got enough volume in his practice that every week there's a lab review session. So everyone who did a Dutch test that week, or everyone who did a Genova test that week, they have to do it in a group. And guess what? It's even better virtually because you are able to actually, most practitioners have told me that if they have a computer in their office, if they can sit side by side with a patient and go through the lab review, it's very it's a helpful dynamic. And so doing it in virtual, the patient has their own labs up on their screen. The doctor is going through and showing, okay, what does this mean? What does this mean? And then they can go and see their own individual information, right? No one's sharing each patient's information. They're sharing sort of like an overview of what that looks like, one that's probably redacted with the name, and then they can look at their own numbers. And if they choose to ask a question, they've signed a HIPAA waiver, and they can ask, hey, what does it mean if it says this? And those questions are valuable to the other people in the group, and now it's super efficient, right? So hopefully you're starting to see that there are parts of the functional medicine operating system that have traditionally been all done in a one-on-one appointment. And if you're able to now, use this group system, one, you're really starting to, take advantage of the power of the group. You're also creating a lot of efficiency. It means if you have cash services, maybe you can create more affordable entry points like Lara Salya did, where it's a $30 entry point to be in one of these groups. Or maybe you can create, maybe you can start to, work with commercial payers again. And we're going to talk a little bit about insurance, here shortly. And then the last one I want to just pick out is Swathi Rao. So she's a PA, and, in the Cleveland Clinic example that I mentioned earlier, the Functioning for Life, everyone goes through a 2-hour-a-week, 10-week program run by PAs, dietitians, and health coaches. And that's like the entry point. That's the top of the funnel. And everyone has to come through that. And the reason why is because half the people get better. And I'm excited that at some point very soon, that research is going to be brought out, because I first heard Dr. Hyman share it in IHS 2019. So that's actually 2 years ago where I first heard that data being shared, and I understand that it's en route towards being published. But half the people get better with just behavior change. Like, I'm sure if you're listening to this right now, you've had plenty of patients where they didn't do any specific individualized protocol. They just started to, get involved in like eating an anti-inflammatory diet or meditating or sleeping properly. The impact that can have on your labs can be significant. So in Swathi Rao's practice, she does it the other way around, where she does the individual care first up. So everyone comes in and does, I guess, the traditional functional medicine way of doing things, which is a long appointment and labs and so forth. But once she's got people sort of through that first stage of like critical, then she uses groups afterwards to start to, keep people engaged into the healthy behaviors after the first session. So I think that I think that that's another example of where you can use groups to continue people's intentions, right? To continue their goals to, to stay healthy and be healthy. So all of these people, I think, are mentioned in the book. These are 4 ways that you could start running groups in your practice straight away. All of these, work well for in a digital format, and that's what we're going to speak about next. Because ultimately, when I read this book, like I first heard about the functional medicine group visit from Dr. Shilpa Saxena in 2013, and we featured content about it on the forum. 2014 is when it started for years. And then, I wrote the book because I really realized, okay, there'd been enough innovation in the space now for this to be a real operating system for the future of care. But then the book came out in January 2020, and then obviously we've had COVID. A lot has happened since then, right? So I've been involved more directly in groups. And so I want to share a little bit of that. But, ultimately, I want to give a shout out to naturopathic medicine. This is what we call the Naturopathic Therapeutic Order, or what they call the Naturopathic Therapeutic Order. It was created by, created by Dr. Pamela Schneider and Dr. Jared Zeff. And ultimately, what the Naturopathic Therapeutic Order postulates is that we should use the lowest cost, least invasive interventions first, and make our way up towards the higher cost, higher force interventions. So just to give you an example, what's at the bottom, right? It's dealing with the social determinants of health and assessing the social determinants of health. You will hear a lot about the social determinants of health over the next few years, because ultimately medical systems are coming to realize that it doesn't matter what medicine you do, if the social determinants of health are not right, it's very difficult for people to get well. And what are we really talking about when we talk about the social determinants of health? It's poverty, right? If you have 3 jobs, 4 kids, and no car, it's going to be very difficult for you to get down to the yoga center, and start a meditation practice, or to, eat the kind of diet that you might want patients to eat. So we have to deal with this, right? We have to deal with this as the common, the lowest level. Then you have stimulating the self-healing mechanisms, right? So you can think about acupuncture or tapping or mindfulness-based stress reduction. These are all ways that we're sort of getting the body to heal and starting that healing process. That's the second phase. Restoring and supporting weakened systems, right? That sounds a bit like functional nutrition. Then we have physical alignment. So you can think physical therapy, chiropractic, osteopathic manipulation. Then we have natural symptom control, which might be like green medicine, using herbs and supplements in place of drugs. Then we have drugs, and then we have high force interventions like surgery. Now, this idea has always resonated with me. It resonates with me as an economist, because we're using the least costly interventions first, and then we're working up towards the most costly later on. It resonates with me in a, as a human, because ultimately I know that this is what people need. I think for doctors it resonates because first do no harm, like you're using the least harmful offerings first. And then in my book, what I gave is sort of like my take on this, which is like, how could this be organized in your average functional medicine practice? And that is essentially, that empowerment groups in the Jeff Geller model, which you'll hear about all in the book, and there's a podcast. If you just Google Functional Forum Jeff Geller, you'll hear the podcast I did with him. It's amazing. He's amazing. I only really made the choice to do the book because I realized like his story was so incredible and so timely, really solving the social determinants of health in really poor people in Lawrence, Massachusetts, by doing this empowerment model. Then you have modality groups. So, Jim Gordon has his mindfulness-based stress reduction groups where he's gone to Kosovo and Puerto Rico after the hurricane, and got insane reductions in PTSD by doing mindfulness-based stress reduction in groups. And then we have nutrition groups. And ultimately, my thesis is these can all be the same groups, right? We can run groups that include nutrition, modalities, and empowerment as part of them. Then you have integrative therapies, so like, acupuncture, chiropractic, and so forth there. Then you have functional medicine, which is like, as I say, functional medicine, I mean like diving deep into the root causes once those have been dealt with, and then only using pharmaceuticals and surgery over. So if this resonates with you, maybe put something in the chat, and we can continue the conversation. I see some questions coming in, so let me just look at some of these and see. Shout out to the MDs, absolutely. Is there a PDF of the presentation? You'll have to ask Fullscript about that, but I'm happy to share this as a PDF. How many are typically in these groups? Great question. There's a lot of different ways that you can run groups. It really depends on what the focus is. In Cleveland Clinic, they're doing anything from like 6 to 12. Dr. Shilpa Saxena said that her magic number was 16. I've seen diabetes prevention groups happening online with 30 people, but that's really more focused on, content delivery. And that's what I want to, I guess, get into next, is really things that I've learned in the last year, because I've been actually very much involved in learning how to deliver groups. So the first thing I want to say is that there is some downside to not being in person, right? There's a certain energetic container that can happen in person that is not possible to completely replicate in virtual. However, there are tons of benefits to virtual too, right? Think about running a group visit series over a number of weeks, and just think about the people that can't make it because the traffic's bad, or it's a long commute, or they live a bit too far away from the office. Like, all of those things go away. The second thing is, once you develop, if you do a group series in your office, you really only have the attention of the time that they're there in your office. If you develop a digital relationship with them through a virtual group visit, you now have a way to continue that relationship in between sessions by sending them a video, or sending them some questions, or nudging them, or, there's many different ways that you can do that. One very interesting thing that I just want to share is, in some of the groups that we've been piloting, we've had people share kind of what they eat. And then you say, okay, well, why don't you take us to the fridge? Take us to the fridge and let's go and see. You're using your phone, let's go. There's a certain level of, like, if we're really practicing environmental medicine, and the environment is like the biggest driver of, and food is the biggest driver of their like environment, you can tell a lot from people from what's in their fridge. And that kind of intimacy is certainly not possible, with in person. Like, people come and they lie to their doctor. Like, this is one thing I want to share. In these groups that we've been working on this year, virtual groups, I've heard the phrase a number of times, I could never talk about this with my doctor. And that should, like, put the fear of God into all of us, because doctors can only make their decisions based on the information that they have from patients. And if patients are going into doctors and are afraid to tell the truth, or afraid to really be clear about what's going on, the doctor is limited. And I've heard also doctors, that start to sit in these groups, and maybe they've had a patient for 10 years. And within, 20 minutes of the first group starting, the patient shares something vulnerably in front of the group that they never shared in that 10 years that could have been the key to their healing, right? And it's because people, once they meet other people that are like them, a lot of times those defenses come down, and those defenses are built into just the patriarchal nature of the way that medicine is created, right? You're a doctor, I'm a patient, you're above me, right? When you get into a different kind of a relationship where there's more of a focus on peers and coaching, you get a lot of vulnerability, and that's really, sometimes can really open up the key to healing. So there are significant benefits to virtual groups, and everyone is comfortable with Zoom. Zoom is a great format for doing it. There's a HIPAA compliant Zoom. You can text people in the chat as it's going on. You can put them in breakout groups. Breakout groups is not that easy to do in person. but it's very easy to do virtually. You put people into breakout groups and you have them like share with each other. There's intimacy, there's connection. So I just want to share with all of you that if you think that maybe not doing groups because, well, let's just wait till COVID's over and I can get people in a room together, you may be missing an opportunity to really hone your skills in something that's obviously going to be valuable, you know, for a long time in the future. So here we go. So that's the first thing. I'm going to answer some of these questions later. There's some great questions here. So I want to go and I want to get to some of these questions, but I also want to just, you know, keep going to some of these other things that we've learned. 2, focus on engagement, right? So the default pattern for particularly doctors, but all can be nutritionists and otherwise, is to lecture, right? Because you've got a lot of information and you've gone through a lot of schooling to get that information. And these patients don't have that information. And so you need to share that information with them. I want to just share with all of you right now is that my recommendation is that in the time when you actually have people in a group, you really want to focus on engagement. You want to focus on getting people to participate in the group. One of my favorite books, I've actually got it on my bookshelf behind me, but Time to Think. And I talk about that in the book that I just gave away to free for all of you. If you missed that at the beginning, if you came on late, if you go to thecommunitycure.com/audiobook, you can get my book for free. In there, I talk about the 10 principles for the thinking environment that comes from this book called Time to Think, Listening to Ignite the Human Mind. And it's a really amazing book, but they go through a process by which you welcome people into a room and you have them feel safe to participate in that kind of group format. And so ultimately, you know, my recommendation is what I've seen is when you leave practitioners to run group sessions, it's like a lecture series. And there's nothing wrong with a lecture series, but ultimately, I would much rather see like a lecture be sent to everyone midweek. And then when people actually spend the time to be together and everyone's in the room together, focus on engagement, ask questions. One of the biggest things that both Dr. Geller and Dr. Shilpa Saxena said to me is that the amount of humility that's needed to be a great group facilitator is very different from being a doctor. Now, I say that now because I just had a question who's saying like, hey, what's the balance? Deanna says, what's the balance of MD, ND, practitioner, and health coach in leading and working with the group? That's a great question. And the truth is, you know, we're still learning about what is the best way of doing groups, and there's lots of innovation happening. Shortly, I'm going to share with you some of what I've been working on, which is that the MD, ND practitioner prescribes the group, and then the group is really a peer health coach situation only. And that's because, you know, typically, you know, what is a health coach? In my estimation, a health coach is, and from my experience, a health coach is someone who reversed their own chronic illness and now wants to be part of a practitioner team, right? And is really focused on coaching, not necessarily on being, they're not a licensed professional, right? They're not a licensed practitioner. So in that way, you know, what we found is if you really want to facilitate engagement, coaches are much better set from their training to run these groups than doctors, because doctors have to unlearn a lot. And, you know, for those of you who have, you know, come from allopathic medicine, who had to unlearn a lot to be a functional medicine doctor, it's kind of frustrating to have to unlearn even more, right, to be a coach essentially in this role. And some people choose that, you know, and Dr. Christopher Moat would tell you that running these groups is the most satisfying part of his week. And there's research from Mayo Clinic showing that if doctors are able to just spend 20% of their time doing what they love, their burnout rates drop almost to zero. And the reason why we have so much burnout is that most doctors are mainly inside the system, spending most of their time not doing anything they love, like paperwork and fiddling with Epic, right? So ultimately, you know, I think there may be, like, if you're a doctor and this resonates with you and you want to do these groups, go ahead, do it. You know, really think about getting some education and further learning into facilitation, Like, it's about not having the answer. If someone asks a question, it's about using that question to start a conversation with the group rather than coming back with the answer. And if you're a doctor, you've basically been valued your whole career for having the answer. And so that can be a very interesting place to have to deal with. So my recommendation is, when you have people in the room, focus on engagement. There may be some content that you need to deliver, but focusing on getting people to feel confident to ask questions, setting the right energy and intention in the room, and when people do ask questions, using it as a starting point to engage other people. 3, coaching is being recognized. So I wanted to share this particularly in that I think medicine is starting to realize that coaching is valuable. And that's not just a recognition in more and more teams having health coaches in, like Cleveland Clinic, and other types of teams, like Dr. Shilpa Saxena always ran her model with a 2-provider model, which we talk about in the book, which is 1 doctor, 1 health coach. And in her model, the health coach is giving the engagement lecture / engagement piece in the circle, and then the doctor is taking the patient out one-on-one to do the insurance billable stuff. But coaching generally is being recognized in medicine and in health generally. And so coaching is becoming a thing, and I'm very, very interested on the cross section of coaching and medical and insurance billing reimbursement, because that's happening too. Billing is catching up to the fact that there will be provider teams, there will be doctors working together, and there'll be more information about this that you can find coming soon. But ultimately the payer system is evolving. There's time-based coding, there's things moving to a point where this is very much more doable on insurance than it's ever been before. So these are just a few things that I've learned. Let me just go through a few questions. Karen, thank you very much. Appreciate that. Health coach, I'm trained to be part of a team, listen to support groups and individuals, connect deeper and gain insight into their shifts necessary for optimal health. One quote that I heard about coaching as a way to think about it that I really liked. Someone said, coaching is helping people identify or examine their own behaviors in light of their intentions. I thought that was really good, because ultimately everyone's intention is to be healthy. So why hasn't that happened, right? That's a lot more of a coaching thing than a clinical thing, right? So I just want everyone to think about that. I'm a health coach, functional nutrition and lifestyle practitioner. What are your thoughts on starting groups as a non-physician? I think you've got a great advantage, Susan Connor. I think you already have, if you have coaching skills and you have functional nutrition skills, you can make excellent groups. So if you go, just make sure you're going to thecommunitycure.com/audiobook. The other links are broken somehow, but the audiobook link is working. What's the best way to recruit for an online group program? Ultimately, you've got to recruit in the same way that you would build, if you're building a regular clinic, you've got to find systems to bring in new patients. And ultimately, where I've seen the most success with groups is when there's a resource constraint, right? So like at the Cleveland Clinic, they just literally didn't have any more doctors. So they were like, and they got 2,000 people on the waiting list. They're like, why don't we just put everyone in groups and see what happens, right? And they have a curriculum and so forth. Terry Walls, the same thing. Tons of people want to see Terry Walls to reverse RMS. She can't see all of them. Let's put them in group, give them a curriculum, and she sees, incredible results with that. So I think, there's definitely, it works well when you've already got a lot of interest in your clinic, and then you can just say, okay, this is the starting point into my clinic now. This is where people start, and we put them into groups, a bit like Kerry Sutton I was showing earlier. Obviously, as I said, most people don't think they want to be in a group. And so, that is still one of the issues that, we see, is that, marketing it, you have to do a good job of communicating what's going on. Do you have people working on different conditions or different systems and balances in the same group? Great question, Gayatri. I think there are different ways in which, yes, certainly there are examples of groups where there's all kinds of different people with all kinds of conditions. We have seen that grouping people by sort of like a macro condition pool has been helpful to just have people kind of dealing with the same issues for sure. That's definitely something that we've seen. All right. Reka says, are these monthly? You can do it however you want. So, you know, there's a lot of innovation still happening. There's a lot of different people trying different things. Also, the ebook is available on Amazon for 99 cents. There you go. Thank you, Aisha. Yes, it is. I'm trying to just make this book as easy as possible for everyone to read, because what I've seen time and time again is that once people read it, they really want to do it. What are the professional liability implications for offering group care in a group? Does this change the provider-patient-client relationship? Is group care still considered providing care in a way that's traditionally recognized in law? Yes to all of, yes, it is care. It doesn't change the patient-provider relationship. The initial vision for the group model was what they call a shared medical appointment. So just imagine if I go to a doctor's appointment with my family, I got 2 kids and my wife, right? We're all sitting in the doctor's office together and we're talking about each of our different things together in front of a group of people. The extension of it is just, now we have, groups of people coming in together. So, the professional liability, you have to check with your lawyer on that. In general, the liability needed to put people in groups and have them talk about their own health is going to be way less than providing drugs or doing surgery, for sure. All right, Jen. Okay, how do you address the root cause of these groups? If it's a gut health group, how do you prevent SIBO from being undiagnosed in a specific person? That's a great question. So if you did a gut health group, there are fundamentals of gut health that you could deal with. You'd have to work through and think about what you want to do in that curriculum. Ultimately, here's the thing. In the Cleveland Clinic, in that model, half the people got better without ever having to see the doctor, right? So the other half didn't get completely better, even though they were now, part of a group. So loneliness was being kind of solved, and loneliness is the biggest driver of all-cause mortality. Right, then and also people were starting to do these healthy behaviors. So if someone is having symptoms and SIBO might be going undiagnosed, that's when they drop down and see the individualized practitioner, and you would do whatever you would do for your SIBO protocol regularly. But half the people in the group are going to get better, because most chronic conditions will significantly improve when you have people doing the fundamentals of health creation day in and day out. Does that make sense? Okay, I think I got all the questions. So I want to share a little bit more here. So, man, I'm passionate about groups, and I know, as you can tell, I think that this is the future of medicine. And ultimately, what I've started to see is that there's a lot of people with great intentions to do groups, but in some cases, the details get in the way. And so, last year I started, when COVID hit, I realized, okay, we really need to learn everything we can about virtual groups, because who knows when we're going to be able to meet in person again. So I started a program, a project, which was called Heal Community. And in Heal Community, this is the first big announcement. There's going to be another big announcement shortly here from Fullscript. But in Heal Community, essentially what we created was a 12-week virtual coaching groups fueled by functional medicine principles. We wanted to really reimagine what an onboarding into functional medicine looked like, away from supplements and labs and towards behavior change, because we know that behavior change is critical. And we also know that many doctors, have aspirations that their patients, they know that their patients have, and this is allopathic doctors too, not just functional medicine doctors, but allopathic doctors, they know that their patients have chronic illness. They know that it's been driven by lifestyle. They know their patients are lonely, but ultimately they're never going to go to an IFM training because they're, 50 years old and they've got a mortgage and they don't want to do anything good, and they're happy with their cardiology practice or their family medicine practice or whatever. And so, you know, one of the things that I've come to recognize is that all of these things have to be thought of before you launch a group visit, right? Before you launch a series, you got to think about the physical space or the virtual management. Like, these are things for all of you that's in the book, but to just tick off in your mind right now. For physical space, virtual software management, you got to think about the content, right? What is content is going to be delivered to these patients? You got to think about the team. You got to hire the health coach or someone to run it. You've got to deliver the service itself. Ideally, you want to be tracking the outcomes so you know whether this thing works or not. And then you want to make sure that people have a great experience, and you want to work out the payment. So these are all the things that you're going to have to work out. Ultimately, you know, what we created was this virtual group coaching experience, right? Where people have a live virtual meetings in groups with the health coach. We have functional education coming through it. We help create health goals and habits that stick. We walk patients through major obstacles. We have the supportive group, and in 12 weeks, we have enough of an opportunity to create enough of a transformation. Dallas Hartwig, who made Whole 30, is a good friend of mine. He made it Whole 30 because 30 days is enough time for people to see enough of a change that they'll keep going. When you take it to 12 weeks, you have a lot more. And so ultimately empowering patients to make sustainable health changes. So we created this 12-week curriculum using the science of behavior change. We came up with a couple of versions here. So you can see immune balance collaborative, metabolic balance collaborative, really rethinking, you know, the entry point into functional medicine to create safety, to help people, you know, do their whole timeline and matrix, to do their SMART goals, to do, you know, focusing on doing the elimination diets and then supporting it. So ultimately, you know, we have launched Heal Community as essentially a service for doctors and nurse practitioners, anyone that bills insurance in America. This is now a virtual, a service essentially that facilitates virtual groups for practices. So in essence, we become like your virtual health coaching team. We are hiring health coaches left, right, and center to facilitate these groups. The most exciting thing is that we have allopathic doctors recommending these 12-week programs, which, if anyone here is in the business of really understanding what it takes to move functional medicine to the masses, that is going to have to happen, right? We can't have every doctor have to come through some training before they do it. So if you're an MD, DO, nurse practitioner, you know, we'd love to connect with you. What the clinic does is establish care with the patient, prescribe the program, and submit the billing. And what we do is hire the coaches, train the coaches, develop the content, track the outcomes, prepare the billing documents, and we're building a custom technology program to really understand the bioinformatics of group care. Now, for every one of you, I wrote this book a year ago. My hope is that every one of you, whether you're in private practice, whether you take cash, if you're in anywhere else in the world, you know, I strongly believe that group medicine, group delivered functional medicine is going to be the new standard of care for chronic disease management. We can get there as quickly as possible. My goal is to get there as quickly as possible. And that means by empowering all of you to take this into your practices and to build groups by yourself. And we created Heal Community to make it really easy for doctors billing insurance to recommend groups, for those groups to happen, for the insurance to pay for it, and for to really reduce the barriers of entry to people to access functional medicine. Now, the second big announcement that we're going to make right now is with regard to Fullscript, because ultimately, and Heal Community is already engaged with Fullscript on this. We've got to make it really easy for you to be able to prescribe supplement protocols to everyone in your community. So I'm going to stop sharing here, and I'm going to bring on you know, the team from Fullscript, who are going to share a little bit more about you know, what they've been working on. So you wanna jump in? Hey, Harry.
Hey, can you hear me?
Yep, we can hear you.
Wonderful. Yes, so my name's Harry. I'm part of the product team here at Fullscript. Thank you, James. That was a really interesting talk. Now, I'm going to segue from what James was speaking about and show you how you can create protocols to share as part of group visits right on Fullscript from today. So from today, if you already have an account with Fullscript, you'll be able to log in, and you'll firstly be greeted by your dashboard, and then you'll be able to click up here where it says prescriptions and then protocols. So we're now allowing any practitioner on Fullscript to share a protocol with a specific group of patients, thus supporting the group visits model. So today I've created an example protocol, as you can see here, called group session protocol. Now I'm just going to click into it and show you. It's pretty much made up of the same things that you'd put in a normal prescription, such as the messaging, the products, the dosage instructions, and any attachments. And you can now go ahead and start to share the protocol that you create. For example, X condition group session protocol. You can then start to share that with the attendees. And you do that by simply clicking that share button right here. And once you've done that, it's really as simple as selecting who you want the protocol to go to. Now, once you've done that and you hit this share protocol button, Fullscript will do the rest for you. So we will send an email, super personalized email with your branding on it to the patient to say, hey, Dr. X has made available the protocol with X condition. And once they've done that, they'll be able to click on that protocol link in the email, and they'll be taken right into their Fullscript account if they already have one, or they'll be prompted to sign up if they've never been on Fullscript before. And once they do sign in, they'll be prompted with that protocol right there in front of them. Sorry. So I'll quickly just share what that will actually look like on the patient side. So I'm quickly going to whip over to the patient view. Just have to give me a second here. Okay. So when the patient clicks on that email, they either sign in or sign up for Fullscript, they will land on this page. So it's super easy and convenient for the patient to learn about the protocol, obviously in the group session that you've had, whether it's virtual or in person. Then once they get home, maybe they click on the email that was sent to them by you, they log in and they see all the instructions and all the product instructions as well, right here in front of them. So it's simple. It's as simple as just adding to cart and checking out, and then Fullscript will do the rest in terms of trying to keep that patient on track with that protocol if needs be. I will open the floor to questions, but it really is as simple as that. We are going to be making iterative improvements to this tooling over the next coming weeks and months as we learn from you, the practitioners, on how you would like things to work better.
Let me ask you a question, Harry. So can you have like a set protocol that you have? So let's say you're doing a gut group and you always, in the second week, you always recommend like this probiotic, this enzyme, and this other product, and then you can just have it that you would just send it to everyone in the group sort of like every time. Can you like set up your preferences in your account?
Yeah, so currently, if say on the second week, everyone came back to your group session on the gut health, you'll be able to add those products to that protocol, and you'll be able to update that protocol in which it would send the patients an email to say, hey, Dr. X has updated the protocol with these details, attachments, products, you name it. So they'll be informed on when their protocol is changing on the Fullscript platform.
Awesome. So where do you imagine that this is going to be like most useful, and how do you sort of, I know a lot of practitioners feel like they like to do very individualized protocol recommendations. So how do you see that this will like integrate with what Fullscript already does really well, which is individualized supplement recommendations?
Yeah, it's a very good question, actually. So we are in the future, throughout the remainder of the year and onwards, going to be trying to make every single scenario super personalized for the patient. So in the future, you'll be able to hopefully specify duration for a treatment plan, the condition that you're treating, and then Fullscript can turn it into a super individualized experience on the patient end. For example, if the gut health protocol was only for a 6-month period, we would try to keep that patient adherent up until that 6-month period. We definitely don't want to come across as like intrusive or invasive to the patient. So we just want to keep those general nudges up to a point of like when they should be taking that treatment plan. if that makes sense. If that answers your question, James.
Great, yeah. So I want to deal with a couple of these questions. If you have more questions for Harry, put them in the I want to hear before we go. So Lynn Perrin says, you know, functional medicine is very personalized. I'm not sure if a one size fits all will work out or be optimal. Look, the lifestyle part, functional medicine is two things simultaneously, right? It's getting patients to do healthy behaviors, right? The sleep recommendation is not individualized necessarily. It's like, yeah, you got to sleep 7 or 8 hours a night, right? You got to deal with your stress. You got to have good relationship with your kids. You know, those kind of things are the same for everyone. That's just health creation. And, you know, the protocols that we put people on will tend towards not working if we don't deal with those fundamental things. And so ultimately, like, while I agree that the principle of functional medicine is individualized, and there's definitely potential, you know, for that, I want to make sure that, you know, what we're talking about a lot in groups is really helping people with the fundamentals of health creation that lead them to not being healthy long term. Also, I want to say is that there is a lot of potential for individualization inside group processes. So when we talked about that lab review, everyone's seeing their own labs, right? They're seeing their labs, and their labs are being explained to them. They're also just hearing from other people share their experience of their labs. So there's individualization there. Dr. Lara Salia, in her intake group, everyone leaves with one of the 6 IFM food plans. So if someone's really like looking to limit their blood sugar, they might be on that keto kind of plan. Whereas if someone's looking to really, you know, get more vegetables in there because they got detoxification issues, they'll be on the core food plan. So I guess I want everyone to just be aware that individualization is possible inside the group model. Individualized prescribing is possible inside the Fullscript model generally, because that's what Fullscript is and has been and it's very good at. And then what we're really announcing here today is a way that you can use Fullscript to make recommendations across a whole group. Now, right now, you may think that not everyone in the same group needs the same supplements, but Fullscript is actually moving towards a vision of being able to prescribe much more than supplements, you know, or a whole range, the full script. And so, you know, we're really excited about this technology coming in that time, so that in the future, you know, it's just making it easier and easier for practitioners. And by the way, when you recommend something from Fullscript, the whole Fullscript technology platform comes in behind you to facilitate adherence and remind people that they should be taking their stuff and to follow up with them. And that's all an infrastructure, a whole digital infrastructure that you'd never pay for, because that's just, you know, what's used. Okay, so here, since the goal is to make accessible to more patients, what's the discount? I don't understand that, Millie. The question, ultimately, in Fullscript, you can make your discount whatever you want on supplements, up to 30%. I know that that's sort of, is that still correct? 35?
I think it's 35% in the US. But you can make individual patient discounts to certain levels as well.
Okay. Let me see. I'm in Canada. Lifestyle is one thing. Prescribing products is another. Yeah, look, I agree, Lynn. I understand that. But I do think that there are some recommendations. You know, think about your own care. Like, are there things that you recommend to almost everyone? You know, and there may be some baseline for a protocol, especially if you have like a you know, gut focus group. Maybe there's, you know, more that you want to be doing on that end. How could supplement recommendations be more accessible for people who may not have the discretionary income to devote to their health? Great question, Aaron. I'd love to know if you have the answer. I do know that medical nutrition therapy is starting to make its way into the payer system. I do know that you can grow every vitamin that you need from sprouting, apart from B12 and D. So if you want to get your patients into sprouting, they can get a full range of nutrition from that, and they can sprout lentils and cauliflower and stuff, and we'll have more stuff on that. I'm hoping soon that we'll be able to prescribe sprouting through Fullscript. Watch this space. But yeah, thank you everyone for your questions. It's been great to be here with you. Harry, thank you for sharing that, and Kaylee, thanks for being here as well. So yeah, this webinar will be available on fullscript.com/webinars very shortly. I'm happy to share the PowerPoint too, but please get the book. Like, the book is literally a 4-hour step-by-step guide in, first of all, getting inspired to why groups and hear all the different ways that it's being used, and then to implement it in your practice. And if you're an MD, DO, nurse practitioner, billing insurance in America, and you think that Heal Community could be a good solution for helping execute group visits in your practice, you can go to healcommunity.com, and look forward to hearing from you. Thanks so much for being here. We'll see you next time.
Perfect. Right.
Cool.
Thanks, guys.
Thank you.